don't particularly like the song, but the video clip's not bad.
It's a little bit
noisy.
of a rock song, loud.
Good in the
not
morning.
really my kind of music either. Okay, well, I hope they woke you up anyway. Welcome to the Hot Shot segment. Today we shall be talking about urology, and
we have made an appointment for you with a doctor, with a urologist. We're going to talk more about this topic today.
So let's bring on the guests. But you guys know the phone numbers, right?
Of course you do. Right? You should know. Okay, anyway, you know how to reach us. 032287
72051
032287
3051.
That's right. And of course, you can SMS if you have a long question. Just type HOT space name or location space comments or questions and send it to 32770.
Polling question, once again. Let's take a look at the polling question, which is going to be on your screen.
That's right. Okay. What is the leading cause of urological diseases? A, unhealthy diet. B, stress. C, genetics. D, sedentary lifestyle. And what do they do, Terrence?
Well, all they have to do is to type A, B, C, or D as your option. Don't forget H numerical 2 before that. Send it down to us at 32770.
Well, you have 4 choices there. Okay,
4 choices.
Will close at 8:45 a.m. as usual.
We have our urologist in the studio, ladies and gentlemen. He's from Damansara Specialist Hospital. He's Dr. S. Rajeentheran. Welcome to the show. Thank you for joining us, Doctor.
Good morning, Doctor.
Good morning to you.
Good to have you with us.
Yes.
Okay, my first question is, of course, what is urology? Perhaps you can tell us more about it.
Okay, basically, urology is a surgical subspecialty. It consists of a surgical study or surgical study on the urinary tract and the genitalia. It includes the kidney, the bladder, the ureter, prostate, urethra, and the genitalia. So basically, it's quite a subspecialized surgical subspecialty. We usually concern ourselves with UTI and stones and cancers and so forth. As you can see in the slide, this diagram shows actually the kidneys and the bladders and the whole system as well. And when you can see here, we are so subspecialized that we have actually again subspecialized ourselves into endourology, which is basically study using scopes. That means we place instruments or scopes into the bladder, into the ureter, and even right up to the kidney. The second is a laparoscopic urology. It's basically making keyhole incisions over the abdomen, placing scopes right through the abdomen, and then doing our surgeries from outside itself. That means basically we remove kidneys, we remove prostate, and we remove bladders. Uro-oncology is cancer of the urinary tract, cancer of bladder, kidney, ureter, prostate, and so forth. Female urology and incontinence surgery, they are basically based on the female section, that is incontinence and so forth. And then we have neurourology, reconstructive, and renal transplantation surgery.
Okay.
And finally, the normal office urology that we usually do.
Now, I guess the most common cases of urological specialist necessity would be bedwetting and things of the sort.
Yes.
ADH is the hormone that is required to control the urine functions at night. So what actually causes bedwetting, doctor? It's quite a common thing.
Bedwetting, there are actually a few causes for bedwetting itself. It's known as actually nocturnal enuresis. It's actually either primary or secondary. Primary occurring if the patient, the patient has it without previous nocturnal enuresis itself. There have been many studies previously. Some people say it's due to a psychological problem. Some people say due to a lot of stress. But recent studies have shown that there may be a decrease in ADH secretion in the night. So now they have been coming up with certain things known as desmopressin, where patients can take desmopressin in the night to try to reduce the amount of nocturnal enuresis. This has also been shown to be effective in even elderly people who have nocturia, that's having to pass urine many times in the night due to many other causes.
Okay. Well, we're aware that there are various urological ailments. Who does it affect more, men or women?
It depends on what type of urological ailments those are. Urinary tract infections, usually ladies. More elderly, maybe probably ladies and mums, almost the same. Cancers are usually the males. And it actually depends. Of course, prostate is only the man. It actually depends on exactly what we are talking about. You know, is it urinary tract infection or cancers and so forth. Even as far as cancers are concerned, there's a predilection to age group as well. prostate cancer, bladder cancer above the age of 50. Testicular cancers is actually 25 to 40 years of age.
Ooh.
Okay,
That's
in that
very
age group,
early.
that's cause for concern. Doctor, do you have any more slides to share with us this morning?
Yep.
Okay, let's take a look at some more slides on your screens right now. As you can see, here are some more slides. What are we looking at, Doctor?
These are actually the common renal and urinary related problems as far as urology is concerned. Most important nowadays, which has taken a lot of publicity, is actually prostate diseases, either prostate enlargement giving some symptoms which is known as BPH, and prostate cancer, which is actually the most common male cancer at the present moment. Then we have other cancers including bladder cancers, kidney cancers, testicular cancers, and penile cancers, incontinence, which is involuntary leakage of urine, stone diseases, and of course our normal UTI or urinary tract infection.
All right, at what point would you recommend a person go on the adult diaper?
Adult diaper. Now basically, I don't recommend adult diapers if possible. We usually try to treat these patients. There's some patients who feel that once they are elderly, it's part of the elderly disease or something like that. Actually, it's not. We can usually investigate and find out the cause of the incontinence. The leakage can either be two main categories. Actually, there are many different categories, but there are two main categories. One is known as urge urinary incontinence. That means the bladder is very active. The person has to rush to the toilet, having urgency, and suddenly all the urine comes out. The other is known as stress urinary incontinence, usually affecting the ladies, but also can affect the men. It's usually the sphincter in the bladder is unable to control the urine, so whenever the person coughs or walks around, the urine starts leaking. So there's actually treatment for that. We usually investigate both medically as well as surgically, and then we usually treat these patients. There are some patients who do not want treatment. We do some modification of behavioral lifestyles and change their sort of fluid intake and so forth. And some of them who don't want surgeries, then they are on diapers.
That's basically my question. How does diet and lifestyle basically affect urological health?
Okay, actually, sometimes, oh, sorry, I didn't get the question.
The diet and lifestyle of a person.
Affect the urology health itself.
Yes.
Okay, it depends on what type of urology health you're talking about. Usually it's best to have just healthy diet. Some people say that persons who are obese, right? Obese has an increased incidence of prostate cancer, for example. Question of whether it's actually due to the prostate cancer or whether it's detected later. A lot of fluids are necessary to try to prevent stone diseases, because stone diseases are due to supersaturation of the urine, or urine getting too concentrated. They form crystals and then they form stones. There are a lot of studies about how to prevent, let's say for example, prostate cancer. They have talked about soybean, they've talked about lycopenes which are contained in tomato, they talk about selenium, they talk about vitamin E and so forth, green tea. But there's no study to actually conclusively say that you can actually prevent these diseases from occurring. There's a very large trial known as the SLAC trial. They started in 2001. The results will be out only after 2012 as far as vitamin E and selenium is concerned in prostate cancer. So my advice is probably just take a very healthy diet and drink adequate amounts of water, about 2.5 to 3 liters of water, to prevent any urinary stones.
There we go. We have a question from a caller. The second caller. Hi, good morning.
Hello, good morning.
Hi.
Good morning.
Good morning, Terence and Sherry.
Hi,
Morning.
who's on the line?
Yeah, this is Siti from Perak.
Hi,
Hi,
Siti.
Siti.
Hi. Okay, my question is for doctor. Okay, my mother is having a regular urination. Okay, so she had undergone a checkup with a specialist, and the specialist found that her muscle is loosened.
Okay.
So what can she do? Should she go for a surgery or what?
Okay.
How I can help her with this problem?
Okay,
right,
thank
great.
you, Siti.
Thank you,
We'll
Siti.
have the doctor answer your question.
Okay, bye-bye.
Doctor.
Okay, basically your mother's problem is actually she's passing a lot of urine very regularly. It's known as urinary frequency. Now, actually, usually when a person comes with urinary frequency, especially the elderly, we usually like to investigate exactly what's happening. There's so many other causes. It may not be actually the urinary frequency. Some people drink a lot of water. So what I do is, first thing I would investigate the urine. I'll do a urine analysis and a urine culture, see whether it's urinary tract infection. Second thing, I usually do what is known as a voiding chart, where we chart down the amount of drinks the patient has, and how often does she go and pass urine, and from there I can analyze exactly what is occurring. She may be having an overactive bladder. I'm not very sure. I have to wait for the investigations. I have to go through a very full history. If it's overactive bladder, there is medical treatment for that. So I think the best thing is, it's very difficult to really diagnose just based on one symptom. I think it needs just a few more simple investigations to detect whether the exact cause of the urinary frequency itself.
It needs a thorough checkup.
Yeah.
Well, doctor, let's talk about UTI, or better known as urinary tract infection.
Okay.
I mean, it affects so many women.
Yep.
What is the cause of it, and how can women actually prevent it?
The usual cause, or the commonest cause, is due to the fact that in females especially, is due to the fact that the female urethra is actually very short and is very near the anus, so there's usually fecal contamination. So what happens is usually it's an ascending infection. That means infection occurs from below, goes upwards to the bladder. Commonly it's just an uncomplicated cystitis. Uncommonly you can get a complicated cystitis, and you get pyelonephritis, that means infection of the kidneys itself.
Whoa.
There are many different ways of trying to prevent this. Drink adequate amounts of water. How do you go to the toilet? You have to wash yourself from front to the back rather than back to the front. Some people have talked about cranberry juice and trying to prevent UTI and so forth. There's been no proper evidence to say that cranberry juice actually really works. But to some people, they feel so much relief by urinary tract infection itself. It's quite often you can see ladies having a urinary tract infection, especially after sexual intercourse. Initially, when they get married, they get what's known as honeymoon cystitis. So that's quite okay. If they get regularly more than 3 times a year, then it needs to be investigated, and then probably needs some prophylactic antibiotics. Males and children, no. Even one episode of significant urinary tract infection needs to be investigated, whether it's due to a stone, due to the prostate, or due to some other congenital abnormality of the kidneys.
Scary stuff there, doctor.
Interesting. Honeymoon cystitis. One of the things you'll get during your honeymoon. Okay, looks like we have another caller.
Hi, good morning.
Good morning. This is Mr. Leong.
Yes,
Hi,
Mr.
Mr.
Leong.
Leong.
One question.
Yes.
One question. Sometimes I'm 59, and sometimes my urine has an unusual strong smell that lasts from might be a week to a month or so. Thank you. Bye.
Okay.
Okay,
Doctor.
Okay, you have an unusual smell which lasts for some period of time. The thing is, I would like to go more to the history usually to find out exactly what are the other symptoms other than just the smell. Are you passing urine very often? Do you have any urgency? You have to rush to the toilet? How many times do you wake up in the night to pass urine? And do you have any bubbles in the urine? Most probably it's urinary tract infection. Sometimes there can be, very rarely there can be fistulas. That means fistulous communication, the bowel, the bowel, sometimes you have bowel diseases who breaks open into the bladder. So they can have a lot of bubbles and a lot of fecal material that can come out through the urine itself. I usually will investigate this, usually with just a simple urine analysis and urine culture, go through the history properly, see that the culture is positive for infection and treat as according. If the infection continuously occurs, then I'll go into very detailed history and exactly find out is there any fistulous communication, or is the prostate very enlarged that's causing all this, and probably treat the prostate.
Okay, now since you mentioned prostate, and prostate cancer is very, very serious for men,
Yep.
what is the rate like? How many men get prostate cancer?
I can't say exactly the rate.
Are there any signs and symptoms?
Yeah, prostate cancer, there are signs and symptoms, but sometimes they can be very vague. It can either be asymptomatic without any symptoms at all, or they can have symptoms of obstruction of the prostate.
Okay.
That means, for example, the first signs usually, or first symptoms are usually getting up in the night to pass urine, urine passing quite often, waiting for some time before the urine comes out, a poor flow of the urine. But these are also the symptoms of the normal benign prostate enlargement. In the United States, they have done a lot of screening programs. In the United States, a national screening program. For anybody above the age of 50, they usually do a PSA, what's known as prostate-specific antigen test, or a PSA test.
Whoa.
It's actually a tumor marker. PSA has been shown to be the best tumor marker so far for any cancer, as far as prostate cancer is concerned. But however, there's been a lot of controversy on prostate cancer, PSA screening or prostate cancer screening. So the rest of Europe do not do a national screening policy. They do selective screening. In Malaysia, it's not a national screening policy, it's a selective screening. So those who have symptoms, then we usually screen, or if the patient would like to screen for prostate cancer. And family history of prostate cancer, I think it should be mandatory to the children. Once they reach above the age of 40 or 50, they should be screened.
Okay, we have yet another caller.
Another caller. Hello, who's on the line?
Morning.
Hello.
Hi.
Hello. Good morning.
Good morning.
Hello. Every day I watch your program.
Thank
you.
Regarding about this urine, I would like to know from the doctor. When I want to pass my urine, I can't control before I reach the toilet. I'm already out.
Okay.
Oh no.
So I cannot, it's difficult, and sometimes I'm traveling. I'm 72 years old.
Okay.
And I'm traveling from here, sometimes to Tanjamaling, sometimes to KL. On the way, there is no tanda where I can stop and remove my urine. I feel it very difficult. Once I had this problem, I went around Templar Park to see no toilet at the petrol station also. No, it was very painful. I don't know how I managed to control it. I rushed to my friend in Sly and left it out.
Okay.
I would suggest this, if you will do any arrangement for this traveler to go to toilet easily. No problem for old lady to look around driving alone.
Okay. We will address your issue. Thank you
yes.
very much
Thank
for
you.
watching us. Doctor, can we help our regular viewer here?
Okay, now what you have is actually a leakage of urine. Basically, in our terminology, is known as incontinence, which is actually an involuntary loss of urine. Now, as you can see in the slide, there are many causes of urinary incontinence.
Okay, let's take a look at the slides right now on the screen. Here are the causes.
Okay, one is stress urinary incontinence, where when you do work or you cough or you laugh or something, it comes out. The second is urge incontinence. That's probably what our previous caller is having, where they have to rush to the toilet all of a sudden. They can't control the bladder. It's due to an overactive bladder. Then you can have mixed incontinence, a combination of both. Overflow incontinence, for example, an obstruction of prostate, where it totally overflows and comes out. And then you can have due to some surgical procedure or some mishaps that occur and the sphincter is destroyed. What I think she has is most probably an overactive bladder with urge urinary incontinence. I think it's best for her to see her nearby urologist and try to find out exactly how her symptoms are, and probably do a Whiting chart. It can be treated, usually treated by anticholinergics and a few other exercises, pelvic physiotherapy and bladder drill and so forth.
Okay, let's take a look at your other slide we have.
Oh, we've got a couple more slides to show you.
Okay.
Here we go. Got
This
a
is
couple more
basically
slides.
some surgery on incontinence. There's an incontinence surgery.
There we go.
Okay. The first on top is what you see is sling surgery. That means you place a sling along the urethra. We can place it percutaneously from below or from above. You try to control those who have stress incontinence. That means whenever they cough and it suddenly comes out. There are some cases we use an artificial urinary sphincter, the one you can see below. It consists of a balloon and sort of a pump. So whenever you want to pass urine, you release the pump and the urine comes out. Those are for sphincters that are totally destructed. That means, for example, somebody has a prostate problem or something like that. Surgery has been done and something has occurred, and Then we have what is known as augmentation cystoplasty. This is another type of surgical procedure.
Okay, let's bring that on the screen. Let's take a look at that one.
Usually done for neurogenic bladders.
What's that?
But
what's a neurogenic bladder?
Then those people who have spinal problems.
Yes.
Because the spine usually controls the bladder. When there's a spinal deficit or a spinal injury, the bladder goes out of control. So they have to pass urine very regularly. Usually we try controlling with medications. There are some times when the pressure of the bladder is very high. So we try to augment the bladder. What is known also as clamp cystoplasty. We split the bladder open, use part of the bowel, as you can see in the picture, part of the bowel, and just cover part of the bowel over the bladder itself. So the bladder now is augmented with part of a bowel covering the bladder itself.
Wow.
So it's trying to increase the capacity of that bladder.
It sounds like something out of a science fiction movie, but actually it's actually happening.
It's like watching Grey's Anatomy. Okay, we have another caller.
Hi, good morning, caller.
Good morning.
Morning.
Hi.
Good morning to you all.
Hi,
I've got a very interesting thing regarding this subject.
Okay.
When I don't drink much coffee.
Okay.
When I drink coffee, when I pass urine after taking coffee, it smells of coffee.
Okay.
Yeah. Now that is more strange is that I've discussed with other doctor friends of mine. They think it's nonsense, but it actually happens.
Okay.
Now, I mixed with a group of friends who smoke a lot of cigar. And, I keep on inhaling them. I don't smoke myself.
All right.
Now, after inhaling all the cigar, when I urinate, my urine smells of cigar. So maybe this doctor is just the right person to
answer your question.
And maybe he can explain whether it is true or not. It is true, but explanation other doctors could not give.
All right.
Thank you.
Thank
now
you.
we know where the cappuccino scent is coming from.
Doctor, your opinion.
What do you think about that?
That's actually quite odd.
Quite odd.
Yeah, I don't think I've come across a case where you can smell cigars, cigar smell from the urine or something like that. You can have cases where let's say you eat something or you eat some food or something like that, and you can pass chili through the urine. That's due to the fistulous communication from the bowel to the bladder.
Wow. But
coffee usually gets metabolized before it reaches the colon itself, so I don't think so.
But what about the color in the urine? I mean, the color does change at times.
Yeah, color does change. It can become concentrated or not. And sometimes there's some products that can change color of the urine. Let's say you eat a lot of beetroot or some dyes or something, the urine turn blue. Turn red.
Wow.
Turn red. So sometimes when the urine turns red, it's not necessarily always blood-stained urine. It can be due to dye or something like that. Coffee, I don't think so. It's a bit odd. Coffee or cigars.
What about the cigars?
I don't think so.
You don't think so as well? So unfortunately, can't really find a solution for you here.
Very sorry.
I guess your other doctors are just as bewildered as our doctor here.
Well,
let's take a look at
research.
more slides. Let's take a look at some more slides.
Okay.
Just find out what else we can
My next
show.
slide is urinary stones.
Urinary stones.
We have
this is another
many different urinary stones.
problem here.
We have calcium oxalate stones, uric acid stones, brucite stones. As you can see, there comes in many shapes, sizes, and compositions
They look like gemstones.
Yeah. And one thing very surprising, Southeast Asia is one of the endemic zones for stone diseases. It includes Southeast Asia, Middle East, and so forth. In the Western Hemisphere, actually, stones are quite a rarity. It's quite very uncommon. Let's say, for example, if you go to the operating theatre in the Western Hemisphere or somewhere there, they probably do 1 case a week, kidney stones or something. But we probably do about 2-3 cases in the public hospital here. They do 2-3 cases a day.
Is it our diet?
It's very, very common. It may be diet, maybe the tropical atmosphere, and a lot of evaporation of fluids, and a person gets dehydrated and so forth. So you can have different types of stones.
That's a big one.
Wow,
in the next slide, I show you a stone.
Let's take a look at more of the slides the doctor has. Quite scary, this one.
This is one of my collections. The stone that I removed. You see, at times you can really find extremely huge stones, and the patient is quite comfortable. He came with a lot of urinary frequency or something like that. That's when they see a urologist. We do an X-ray, and you find out suddenly, this stone is extremely large. It fills up both my palms. It's about 1.2 kilograms weight.
Whoa.
Wow.
That's huge.
How did that get in there?
That has been the largest so far that I've ever seen. I was quite shocked when I saw the X-ray. I was wondering what
How
exactly.
did that
It didn't
get
go
in
to
there?
the Guinness World Record, did it? That's big.
That's huge.
Yeah.
How did it get in there?
He had some. It actually starts off with crystallization and small
It's really
stone
getting
formation. It
there.
slowly starts getting larger. Usually, when it reaches certain diameter of 1-2 centimeters or 3 centimeters, usually the patient gets symptomatic. I'm quite surprised that this patient managed to carry the whole huge stone.
How big is he? I mean, is he
a big guy?
Oh, he's about 60 years old, 50, 60 years old. Yeah, I think he had some problem with the urinary bladder where he couldn't. I mean, there's a lot of retention of urine, so a lot of crystals starts forming, aggregating, and condensing together, and then they form a stone.
Is there any particular type of food that we should avoid in terms of urological health?
Urological health or urinary stones?
Basically both.
Okay, as far as urinary stones are concerned, we usually investigate exactly what type of stone the patient has and exactly what's the cause. If they have uric acid stones, then most probably he passes a lot of uric acid into the urine, or he has got a high uric acid content in the blood. So we usually suggest him to take less purine diet. That means meat, internal organs, icham bilis. Those have a very high uric acid content, so we usually ask them to reduce that amount. The commonest cause is actually due to calcium stones, calcium oxalate, but it's not a good advice to ask anybody to reduce the calcium in the diet, because what happens in the bowels or in the intestine? Actually, calcium combines with oxalate, and then they are passed out. Once you reduce the calcium diet, oxalates will be absorbed, and then you get oxaluria, which is oxalates in the urine, and then they form calcium oxalate stones. So I think the most important as far as diet is concerned for urinary stones is drink adequate amount of water, about 2.5 to 3 liters of water every day, so that you prevent urinary concentration and supersaturation.
We have two callers.
Two callers. Let's take them both.
Callers.
Hi, good morning.
Hello?
Good morning.
Hi.
Good morning.
Yes.
Hi, good morning.
Ida here.
Hi, Ida.
From KL.
Hi.
Yes. My son has been diagnosed with reflux stage 5. And I would like to know, his kidney has been compromised by 24% at the moment. He's 8 years old. I would like to know what should I expect in the next 5 years or 10 years.
Okay.
Thank you. Thank you, Ida. Should we take the next caller? Hello?
Hi.
Hello.
Hi, who's on the line?
Hello, I'm Yusuf.
Hi,
Yusuf.
Yes, hi. Can I speak to the doctor?
Yes.
Sure, go ahead.
Okay, I did an endopilotomy
Okay.
at the clinical hospital about 3 months
Sorry,
ago.
what's your age again?
Again?
What's your age again?
My age is 48.
Okay.
48.
So you had an endopilotomy done recently.
Yes.
Yep.
Okay, there is a tube from my kidney to the bladder. They have removed it.
What was that?
Till today,
Tube from kidney to the
Okay,
bladder.
right.
yeah, they have removed the tube already.
Okay.
Now, till today, I still have the swelling at the bottom of both of my feet. Is that because of the kidneys itself, or is it the urinary system again?
Okay.
How was your kidney function before this?
I didn't have any problem, but this is my first case. And only my creatinine was a bit high. It was about 1.3 before I did the surgery.
Okay. Is this swelling something new? All of a sudden, is it very large? Is it
No,
just
no,
mild?
it's not very large. It's just mild, but I can censor the swelling.
Okay. Are you still immobilized or are you walking around?
Yes, I'm walking around. I'm working already.
Oh, you're working already.
Yeah.
I don't think this swelling is related to the endopilotomy at all.
Okay.
I don't think you'll be having renal failure this time.
Okay.
I'm quite sure that you have two proper functioning kidney, or 48 years old. Most probably you don't have diabetes or hypertension in the absence of any comorbidity. I don't think your swelling is related to that. It may be a dependent edema. Probably you need to go back to your urologist and let him have a look at it. But I really doubt it's due to the endopilotomy itself. Even if anything happens to that one kidney, your other kidney is still functioning, so it shouldn't cause a renal failure unless you have some other pre-morbid condition before this.
Okay.
Hey, what about the
Hope
first
that
question?
answered your question,
Is that on
Yusuf. Thank you very much. Ida's question on her young son.
Okay. I'm very sure you have already seen a urologist for reflux stage 5, 8 years old, with compromise. I'm sure that if it's a reflux stage 5, it depends on bilateral or unilateral, but even if it's stage 5, I'm sure that your child would have already undergone an operation, most probably a urethric reimplantation. And as far as the compromise is concerned, it depends on how much of renal function is still left. Usually, if they're caught early, if they're caught early, the outcomes are reasonable enough. So it depends on when is it caught. Is it already in almost renal failure, or how the function, how often has the child has been having a urinary tract infection. So it's a bit difficult to really prognosticate without having more data or without looking at the patient itself. Usually reflux we grade it from grade 1 to grade 5. Grade 5, that means the kidney is swollen and so forth. Usually grade 5 requires a surgical intervention, but it depends on how we look at the patient. The patient needs to be assessed and need to be assessed by a urologist, and then decide whether intervention needs to be done or whether it's already been done and how the follow-up is going to be.
Okay, looks like we have 2 more callers, doctor. Let's have these 2 callers.
Hi, good morning.
Hello.
Hello,
Hi, who's on the line?
I'm Chan here from
Hi, Mr.
Semenye.
Chan.
No, I'm Chan.
Yes,
Okay.
yes, Chan.
Yes, I'm from Semenye. I'm 65. 7 years ago, 6 years ago, 6 and 7 years ago, that means I had 2 operations on fistula.
Okay.
And then after that, the 3rd year, I had my bypass.
Wow.
So now I'm 5 years after the bypass, but of late I seem to have some what you call this urinary infection. And I had taken a course of what you call this antibiotic, but still the thing persists. Can you explain why?
All right, thank you, Chan. We're going to
Thank
take
you.
we have
We have
another
another
caller.
caller.
Hi, good morning.
Hi.
Morning.
Hi, good morning.
I'm Sue.
Hi, see you.
Sue.
I would like to ask the doctor,
Go ahead.
why sometimes I urinate a lot of bubble? Just want to know what is the cause of the bubble.
Okay.
Okay.
Thank you.
Thank
Thank you
you,
very much,
Sue.
Sue.
Right.
I'll
Doctor.
answer the second question first. Usually bubbles may be caused due to some amount of urinary tract infection. There's some type of bacteria which can cause a lot of bubbles and so forth. I can't really definitively tell exactly what's happening. I would place urinary tract infection as my first diagnosis. If there's a lot of bubbles, I'll send a urine culture, treat specifically exactly what organism we are talking about. Probably you need to get an X-ray and see whether you have any underlying stones and so forth. If the bubbles do persist, then I'll investigate and see whether there's any fistulous communication to the bowels or not.
Okay, how about the other
Okay,
caller,
the other
Chan?
caller.
65 years old male, bypass done about 5 or 6 years ago, now came with so-called UTI. Actually, there's a misinterpretation of what is actually UTI. Usually the public and most people think that UTI is something that you pass urine many times and you do a urine analysis in the GP and it shows some amount of white blood corpuscles and then you diagnose it as urinary tract infection. No, that's not urinary tract infection. That's just lower urinary tract symptoms, what's known as LUTS. What you need to do is actually investigate exactly, are you actually having urinary tract infection or is it actually the symptoms that needs to be investigated itself? For example, in a urine analysis, if you have some amount of microscopic hematuria, blood cells in the urine. Blood cells in the urine is a very important indicator. It can mean many things. It can mean a stone, it can mean cancer, bladder cancer and even prostate cancers and so forth. So I wouldn't jump in the conclusion of urinary tract infection unless I get a urine positive culture. That means urine culture is positive. Now you're 65 years old, you have already had all this. I would place a very good bet on only two things, or rather two things on my mind. Prostate enlargement or BPH, that's my first condition, and other one overactive bladder. Sometimes you send urine, it can be contaminated because it depends on how sterile you send the urine. If you should actually send a midstream urine and you should clean your area before you pass the urine. So you can have some amount of contamination which may not be significant and it's been interpreted as urinary tract infection. Sometimes stones can also give these symptoms. So I would do a urine culture and probably if you are having this quite often, I think you should see a urologist and get it sorted out. It's not necessarily a urinary tract infection alone.
Doctor, can people actually still lead an active lifestyle when they have urinary incontinence? Just in short.
Yes, they can still have an active lifestyle. Urinary incontinence can be treated. It depends on what type of urinary incontinence it is. Even stress urinary incontinence, they came out with a new drug. They're still awaiting FDA approval. It's known as duloxetine for stress urinary incontinence. So even with incontinence, you can still live a very good life. It depends on what type of quality of life you want to achieve.
Right. Okay, thank you, doctor. Okay, it looks like we have the polling results.
Let's take a look at it. It's on the screens right now.
Well, 42% say unhealthy diet, 32% stress, 26% say genetics, and none at all. Is that 9% or 0?
That's about 0.
0. Okay, what is your comment on that? Just in short.
Leading cause. Actually, I don't think there's a leading cause for urological diseases because urological disease is a total ocean of its own. You know, there are many other many things that consist. But I think all four would actually be
Very
equally important.
Interrelated.
Genetics may be for cancers. Unhealthy diet maybe for stones and so on.
There you go.
Right. Thank you so much, doctor, for joining us this morning.
Yep.
Well,
Been
and
great
thank
having
you
you.
to all our callers for calling us out
right.
this morning. I hope you all have been well informed. And to those of you who are going out for honeymoon, make sure you bring a lot of cranberries.
Okay.
Stay tuned with us tomorrow. Okay, this is Sherry and Terrence signing off.
Bye-bye, Malaysia.
Make this kind and clear, just a chance that maybe we'll find better days. 'Cause I don't need boxes wrapped in strings and designer love and empty things, just a chance that maybe we'll find better days. So take these words and sing out world, and there's 10